Welcome back, everyone, to the Mental Health Entrepreneur Podcast. I'm Rachel Harrison, your host, and we are going to talk today about a unique treatment for addiction from Dr. Libby Stuyt. Dr. Stuyt is a board certified psychiatrist in addiction. She has run treatment programs along with complementary approaches, and she has created the 5-point ear acupuncture called NADA. NADA, am I saying that right, Dr. Libby?
Right.
As well as BST, brain synchronization treatment. She currently trains on these things. She also speaks in a lot of professional circles. Libby, it is great to have you with us.
Thank you. I'm happy to be here. And just a clarification, I didn't start the NADA protocol. I have just been involved in it in a long time. It's
Ah,
actually been around for a very long time. It's well, not that long. It's been around since the 1970s, which it's the whole history behind it is very, very fascinating.
well, maybe
Uh,
we can dive into that a little bit for sure. Yeah, so let's talk about you for a moment. How did you get started in the addiction field?
that's a really long story, but to make it very brief, I was in medical school and loved everything. I couldn't figure out what I wanted to do.
Hmm.
And the chair of psychiatry was a smart guy, and he said, just sign up with us and we'll let you do a rotating internship. And then you can rotate through all those things as an intern. And if you decide you prefer something else, you can go transfer. And
Hmm.
so I did. So I rotated through OBGYN, pediatrics, internal medicine, family medicine. And then I did psychiatry. And the intern job was substance abuse. And I had never had any experience with that because I didn't have any family history. I didn't really know anything about it. I kind of had the image of the Skid Row drunk. Um,
Hmm.
and I just fell in love with it because to me, it was the first time ever I was in a medical field where you're not responsible for them getting better. You're teaching them how to get better. And then they choose to then use the skills you use or not, and your job is to encourage them to use the skills. And
Hmm.
I just really liked that, so that's how I ended up staying. And then I have my whole career has been really been devoted to behavioral health, addiction, um,
Hmm.
psychiatry.
Right.
So I've been doing that now for 33 starting 34 years. Yeah.
Wow. Well, and that's saying something because a lot of people that I have talked to over the years as a therapist myself have gotten burned out in the addiction field specifically. It can be difficult work.
Yeah, no, I agree, but it's very rewarding because when people really finally get it, I think
Hmm.
recovery is completely possible.
Uh-huh.
And I have seen so many people, what I believe is are fully recovered. But then you have to understand that fully recovered doesn't mean you can use the substance again. You can't ever use that substance again.
Hmm.
You learn alternative ways to live your life without using those substances.
Yeah. Yeah. And so, how did you bring in some of these complementary approaches? Let's go back to that 5-point ear acupuncture. How did you come across that?
Well, that was a very interesting thing too, because I had come from Texas to Colorado. So I came back to my roots in 1999 to become the medical director of a program that was at the state hospital, which was like kind of phenomenal.
Hmm.
It doesn't exist anywhere in the country. 90-day inpatient treatment program for people with dual disorders. So
Okay.
have to have mental health and substance abuse problems. And I came to make that program tobacco free. And so we did, we made it tobacco free in 2000. It's
Wow.
been tobacco free ever since, because I do believe you have to address all addictions at the same time in order to have the best outcomes. And I think
Ah.
that's really backed by science. And so anyway, I went to an American Academy of Addiction Psychiatry meeting in December of 1999. So just before we went tobacco free, January of one. And Alan Leichner, who was the head of NIDA at the time, was standing around in the conference saying, I've just been to Yale. I've just seen this remarkable treatment that should be available in all treatment programs. And we're
Mm.
saying, well, what is it? And he said, well, they call it nada. That's nothing, right? Nothing in Spanish.
Yeah, yeah.
But it stands for the National Acupuncture Detoxification Association. And it's
Mm.
needles, 5 needles in each ear. And so we're all very fascinated. But then I come back to Colorado, and the next day, this medical acupuncturist called me and said, why are you not using the NADA protocol in your program? And I went, that's so bizarre. I just learned about it. And
Mm.
then she said, well, we're having Michael Smith, who set up the organization, coming out to Denver next week, and he's going to be talking to the Mile High Council. Why don't you have him come talk to the state hospital? So we did. And of course, it was a CME talk for physicians, mostly psychiatrists, and then nobody was interested. But what he did was he needled the administrators, and that's all
Oh.
it took. And the administrators said, ooh, we really need to get this here. This is really excellent. And and so we got trained, and I started using it then. I, of course, was very skeptical because
Mhm.
I'm a Western trained scientist.
Yeah,
Um,
yeah.
but I knew I would have to prove to myself that it actually did something. So I started collecting a lot of data, and I've actually published on our experience in several cases because I initially was very skeptical, but I became totally sold. This is like a phenomenal treatment that's not standalone. You cannot use it by itself. It's an
Mm.
add-on treatment, and it actually has support by SAMHSA. So if you look at tip 45, which is one of the tips that SAMHSA puts out,
Uh-huh.
there's a section in there about complementary treatment. And so it's basically an evidence-based adjunctive treatment for substance use. But it's also been found to be a really wonderful treatment for everyone. You don't have to have substance abuse problems because it's really a stress reliever. So and it's a stabilization tool. And
Ah.
so I have trained many people who use EMDR, who then use this protocol either before a treatment or after a treatment with EMDR.
Hmm.
And so, one of the first things working with trauma is you have to have stabilization skills.
Yes, you
And
do.
this is one of the most profound ways to help people learn stabilization skills. Because even if they've never sat still, when you get 10 needles in your ears, you sit
You're
still.
gonna sit still. Yeah.
And there is this immediate benefit. And so
Hmm.
what research is showing is that it really is helpful in engaging people and retaining them in treatment. It really helps with the dynamics between the provider and the person receiving the treatment. It, to me, in psychiatric terms, it's like the best thing to deal with transference and countertransference
Oh.
because you it's an energetic treatment, so it's
Mhm.
an energetic phenomenon. And when you're putting the needles in, it's not just the needles, it's what your intention is. And so many people ask, well, what is this going to do for me? And you can't really tell them because in Chinese medicine, and that's a big part of the training is understanding the difference between Western and Eastern
Mm.
approaches to medicine. In Chinese medicine, they believe that you're energized by this life force energy called qi, and when
Mhm.
you have any problems at all, your qi is diminished and stagnant. And so the purpose of acupuncture is to nourish your qi and to get it moving. And so but your body decides, so it's your own body that decides what it is you need to benefit from. Is one of the things I initially was very
Mm.
skeptical about, like, yeah,
Yeah.
because the trainer that trained me was saying, this does exactly what you need it to do. Whatever you need it to do, it does it. And I said, well, we don't have any medication that does that. So
And nor do we
um,
research things like that. Like, how do you quantify that in a research study, right?
exactly. And so but over my time now, because I started using it in 2000, I've used it ever since.
Wow.
Uh, and I've trained lots of people. I worked really hard to get a bill passed in Colorado in 2013 that allowed licensed behavioral health people to do this, because before that, it was just physicians and acupuncturists who could
Mm.
use these needles. And then we have subsequently had two separate bills increasing that to now in 2021, we now have any professional. So anybody who has a profession can be trained in this. And we have trained a lot of peer coaches. And so they're
Hmm.
like phenomenal at this because, they're newly in recovery. It gives them a whole lot of efficacy. Like, they now have a job where they can actually help people. And it's very low cost. Treatment costs like a little less than $1, the needles and the supplies that you need. So that really the only investment is really the training.
Mm-hmm. Mm-hmm.
and and there are two organizations now, and I'm sad to hear that you don't know anybody in Maryland doing this, because the National Acupuncture Detoxification Association headquarters are in Bowie.
Oh,
Now, this is one of the organizations that does trainings, and the other one that I'm now doing trainings for is called POCA, or People's Organization for Community Acupuncture.
okay.
So these are two trainings nationally, national organizations. They're located mostly, I think, in Oregon,
Mm.
and who do trainings. And the states all differ in terms of their laws,
Yeah.
uh, and and it depends on, a lot of it is based on heavy acupuncturists. Like, interestingly, in Hawaii, the only people that can do this are acupuncturists, not even physicians.
Oh, wow.
In California, it can be physicians and acupuncturists. It's kind of the states where there's a lot of acupuncturists. It has been more resistant to allowing this to be used by other people, which is
Ah.
really kind of sad, because what people are finding out in Colorado, the acupuncturists anyway, are it really increases their business, because
Mm-hmm.
people come in, they get just 5 points, and they feel really great, and then they want you to fix everything else. And I have to say,
Mm-hmm.
well, I can't do that. That's not in my scope of practice, but I can refer you to an acupuncturist. And so a lot more people are seeing acupuncturists, I think, as a result of this protocol.
Right. Right. That makes perfect sense to me. Yeah, and I'm going to go research and find out what the laws are here. That's very curious.
Yeah, I am not really clear on Maryland what the laws are. I know that I've been working with many states to get their laws changed. I was successful in Utah to get the laws changed to now they have the ability for licensed behavioral health people. But I think they're going to even try to do another law next year, because they're realizing there's still not enough people. Because this is something that
Yeah.
everybody should have access to. I mean, some of the most powerful places I've seen it used in are needle exchanges. And that's where I've actually
Mm,
seen real magic happen, because people are coming in to exchange their needles, that they're using for their drugs,
yeah.
and then they can get a treatment in a room in that facility. And I've been in those rooms where people are sitting there with needles in their ears, and they've got peer coaches in the room that are volunteering, and the people are saying, how can I get off this stuff? And then they start saying, one peer coach says, well, I did methadone, and this is how I did it, and this is where you go. I did buprenorphine, and this is how you do it, and this is where you go. Or I went to treatment, and this is a treatment program you can go to. And so that's like magic to me.
Mm,
And it's just from putting needles in people's ears, which is pretty cool.
it is pretty cool. So, what are some of those underpinnings? You kind of mentioned that this has been in Chinese medicine for how long did you say?
Well, Chinese acupuncture has been around for centuries.
Yeah.
And the use of ear acupuncture is relatively recent. And that was discovered basically in the 1950s by a neurologist in France, who discovered that you could treat the entire body in the ear. And so there are
Mm,
auricular acupuncturists who use lots of points. But then this was developed in the 1970s.
okay.
And that was because of a really severe opiate epidemic. that was happening in this country, but we really never heard about it because it was really affecting just people, Black and brown people. And it
Mm,
was in the Bronx in New York. And there were two factions. The Young Lords, Hispanic folks mostly had come from Puerto Rico, and the Black Panthers, who were African Americans who had come from the South to live in New York. And so they were living in this very poor area of New York City, and they have a hospital there called Lincoln Hospital that they identified as the butcher shop because they were not
mm,
getting really good health care. And there were rats in the emergency room, and there were all kinds of things going on. And they then kind of staged a takeover of the hospital, a nonviolent one, where they were demanding healthcare rights. And at the same time, in China, there was a neurosurgeon who he he was doing neurosurgery, but he was using ear acupuncture as a preoperative analgesia agent to help people calm down, relax before he did surgery.
mm.
And he made the observation that people who were addicted to heroin or opium did not have withdrawal when they were in the hospital. So he actually recruited people to come, and he did a study where he showed that he could detox people off of heroin and opium using ear acupuncture. So he
Wow.
published this, and then it got to be an article in the New York Times. And so these groups, the Young Lords and the Black Panthers, read about that in the New York Times and then wanted to know why they couldn't have this as well. Because what had happened at that time, Lincoln Hospital actually became one of the first sites for methadone maintenance.
Mm,
Methadone was discovered in the 1960s, and then they started using it as a maintenance drug. And the people in that were receiving it were very skeptical, believing, that the government was trying to control them, and so they weren't really happy with that treatment. And so they actually then together with so the people that worked in the program, and some of them went to get trained in acupuncture, and they developed this protocol. And so this protocol was developed over time using
mm,
Eastern and Western medicine theories and the patient's responses. And so there are these 5 points, and it's a standardized protocol. That's how it can get past
mhm.
acupuncture laws, because it's not really acupuncture. In fact, we don't even use that word. We call it acu-detox or acu-wellness.
Oh, okay. Okay.
And because it really isn't acupuncture. You're not diagnosing the person, you're not determining the points, you're just using this standardized protocol.
Hmm.
And and I actually have used it to detox somebody off of heroin, which initially I thought, how can that possibly work? But the treatment program I was running, you had to be sober when you came in, and most people were sitting in jail
Mm,
getting sober coming in.
mm,
But because of the opiate epidemic, we started seeing people coming in full-blown opiate withdrawal. And I've tried it, and it actually works. But we also found, so some of the stuff I've published on is the experience that we got, that what it helps with the most. And so it really helps the most, like I said, with retention, participation and retention in treatment. The more people get it, the more longer they stay in treatment, the more open they are to the other things that they're learning in treatment. But the other
mm,
things that are really powerful is it helps a lot with anger. Um,
mm.
so basically affect regulation. So it helps
Yeah.
with anger, anxiety, depression. It just helps. It's a really significant aid.
Wow. I mean, well, that affect tolerance piece is what we spend a lot of time on in therapy, right? So that's
Exactly.
a big piece. And I think that's also often what is triggering for people in addictions, right? It's feelings about things that have happened or things that they're going through. So that's pretty profound. And so this is done every single time that they're seen. It's not just a once and you're done.
Right. No, it's
Okay.
better. So basically, what the person who trained me told me was that it works immediately, but in order for it to last, you need to do it regularly. And
Okay.
so that's what we set up in the treatment program I ran. We had offered it 5 days a week, and that's really awesome if you can do that in a treatment program. But therapists that I've trained, they'll offer it once a week when
Hmm.
they see the client, either before or after or even during a session. And then you can use beads or seeds on as acupressure that you put on after you take the needles out, and then they can keep them on for the week,
Hmm.
and then they come back and get it again. Or most of the research, if you're trying to show a change, like there has been some studies on using ear acupuncture for smoking cessation, uh,
Mm.
it, it shows that you kind of need to have it at least 3 times a week.
Okay.
And it's not a standalone treatment again. It has to be with education and counseling and,
Hmm.
all the other components which help people really resolve. And that was what I initially told all my patients it was for, because I, again, skeptical, I didn't know what it would do. I said, the reason we're doing this is to help you to quit smoking, because now you can't smoke anymore. And it really did help with that a lot. So people who were really angry that they couldn't smoke, they would
Hmm.
get a treatment, and then the cravings would go away. And then we had it kind of on demand. So people, if they wanted extra, they could get it. And that's the beauty of having an inpatient setting where you have all your staff trained.
Right.
Right. And right now I'm really working very hard trying to get it into jails and prisons,
Mm.
because
Wow.
one of the really interesting things about this protocol is, even though it was developed in the United States in New York, it's used more in the rest of the world than it is in the United States.
Hmm.
And most of the Scandinavian countries have trained an incredible number of people, and it's in most of the prisons in the UK and Northern Ireland and Norway and Denmark. So they're using it in prisons because they find that it really helps decrease violence.
I mean, that's phenomenal.
And
Yeah.
we have a sheriff in Summit County, Colorado, who has uh, there's a therapist who works for him who I'm working with to become a trainer, and he has gotten AccuDetox and EMDR into the jail, and they're having really great results. So,
Wow.
the jail is a very traumatic place,
Yes, it is.
and most people that are in there already have a lot of trauma.
Hmm.
And so this is they discovered after 9/11 that this was a really great tool to help with trauma.
Hmm.
And that, I think Bessel van der Kolk even talks about that the number one thing people uh, identified as being helpful after 9/11 was acupuncture. And it was really this standardized protocol because that's what they were offering. And people were filling up rooms where they would come in and just sit there for 30 minutes and get a treatment and then feel much better. And so, even though it's not a standalone treatment for treating trauma,
Hmm.
I believe it can be a standalone treatment to prevent post-traumatic stress disorder,
Oh.
because what we do know about PTSD is the way that is really guaranteed to happen is if you don't sleep after a trauma, and
Mm.
you don't digest those memories and incorporate them and get them assimilated so that it goes into your long-term memory as opposed to being stuck in your hippocampus.
Yeah.
And the number one thing that this really helps with in those people is it helps people sleep. So people in substance abuse treatment, that's their biggest complaint. They can't sleep because the substances they were using to help them get to sleep, they can't use
Mhm.
anymore. And so this is one of the biggest things we saw was helping people sleep.
That's phenomenal. Is there any a paper or anything going to be published out of this combination of the
Yeah,
AccuDetox and
well,
EMDR?
I could send you the article that Gabe Greenwald wrote. Yeah, so they're actually studying it right now. I mean, it hasn't been a year yet, so they don't really have all the data. I think
Okay.
they do have the data on EMDR, but they don't
Hmm.
have the data yet on the AcuDetox. And the reason the AcuDetox is so, I think, a desirable thing to use is you don't have to have a license. You don't have to have, a master's level or higher, which you have to have in order to do EMDR.
For sure.
And
Yeah.
that's, yeah, that's why we actually are doing what we call brain synchronization therapy.
Uh-huh.
And that actually came out of a trainer in the Springs. I don't know if you know him, John Hartung. He is a EMDR trainer in Colorado Springs. And he designed this thing that he calls brain synchronization therapy that he uses around the world to train people how to do basically EMDR light. So it's like
Mm.
EMDR, but it's softer, slower, gentler. Um, and so I actually took a training from him. Again, that was when I was like really skeptical. Uh, but I became a really strong believer because I took some of my staff into that training, and they just have bachelors, they're not masters.
Hmm.
Because the state hospital couldn't afford to hire all these people with a lot of credentials. And they became very effective trauma treaters. I mean, it was amazing. And so I took this training, and then I ended up paying him 3 times to come down and train my staff over several years, because people get trained in things and then they leave. And so you
Yeah.
get staff. And so at one point he said he was tired of coming down, he was just going to make us trainers. So this was my co-therapist. So my co-therapist was our trauma therapist at my treatment program. And so we have been now doing these trainings now for like 10 years. And I'm hoping that he's trained some other people to do this, because we're a very small number of, you know,
Mm.
but we just finished a training, and it was mostly all therapists. It was 19 people. Um, but but they're all people who are working on their masters, so they will be able to do EMDR. But this is something they can do before they actually get that credential. And we've actually trained quite a few EMDR therapists, because it's skills that, you know, a lot of self-regulation skills. So in the training, we teach heart math. So
Mm.
do you know what that is?
Yes, I do.
Biofeedback on heart rate variability.
Hmm.
And then tapping, like John
Hmm.
Hartung's
Like
form of
EFT tapping.
EFT. Yeah.
Hmm.
And then TAPAS, which is Elizabeth Tapas Fleming thing. So we teach those as skills to help regulate, so keep somebody in their window. And then we do a lot of work with, we don't want anybody to abreact. And that's because, I have worked with a lot of clients who have had EMDR and say they will never ever do it again.
Mm.
And that was because they had an abreaction. And sadly, that was either not a well-trained therapist, or somebody
Yes.
who wasn't really recognizing that they were outside their window. So we do a lot of training on, keeping in the window and what to do when they get outside their SUDS, window. And then a lot of training on dissociation as well, because then that becomes
Hmm.
a big problem. Um, but it's just been really, really effective and very cool to do.
Yeah. Yeah. Well, and that's what I was thinking when you were talking about this ear acupuncture, is that it was keeping people in their window of tolerance. And we have a lot of non-therapists that listen to this podcast. So for those of you, basically, window of tolerance is that place where you feel like you can handle anything. You're kind of in a relaxed place. You can handle anything. You're not overly stressed, or kind of what we would call hypo aroused, which kind of like shut down. So that window of tolerance is kind of what we're talking about there. So it sounds like that ear acupuncture is very helpful for setting the stage of someone being in their window of tolerance. That's kind of what I was hearing as you were talking about that.
That's absolutely true. And
Hmm.
yes, and so if you know about heart math and coherence, heart heart brain coherence, I had this incredible experience because when I very first got the heart math hardware software for my staff to use in the program, pretty much everybody was fully incoherent. They're in the red, and they have to learn how to
Mm,
get themselves into coherence. So Fort Carson, which is in Colorado Springs, this is several years ago. They've actually had a thing in the paper about we're having all these people coming back from Iraq and Afghanistan. If anybody has any things they can suggest, we're open to anything. So I called him and I said, well, I have my little dog and pony show I could come and talk to you about. And so I went and talked to about 25 therapists that are at the hospital there. And I first talked about nada, and I put
mm,
needles in everybody's ears, and they all got a treatment. And then I talked about heart math, and I got the computer out, and I got people, and I had people start hooking up.
mm.
Everybody 100% coherent. And I went, oh my gosh, you've got the most healthy staff I've ever seen. And then I thought, wait a minute, I just
They
put
just
needles in
did
their
the.
ears. And that's what I found. If you have somebody who really is struggling, like with the biofeedback, and they can't seem to figure out how to become coherent, just put needles in their ears and they become coherent immediately.
Interesting.
Yeah.
Well, I love that. Unfortunately, we are just about out of time, but if there's kind of one thing that you could say to our audience about anything really, what would it be? What would be your words of wisdom or your advice or your inspiration?
Well, I would just encourage people to look into this, the ear
Mm,
acupuncture. Either you can go to the NADA organization, which is NADA, but it's actually the website is www.acudetox.com, or the POCA organization. And so that's POCA, and
hmm.
I think it's ears. If you just put POCA in the search engine, you'll
You'll
find
find
it.
it. We can put the
And
links in the show notes too, so people can access it there.
that'd be great.
That's
So
awesome.
just to learn more about it and see what you just have to know what your state laws are.
Yeah.
But there are more and more states allowing this. And like Wyoming right now, pretty much anybody can be trained.
Hmm.
Um, and so it just depends on the state, but I really encourage people to look into it. It's a really great tool to have in your toolbox.
Yeah, and I love that in states where it's allowed, anyone can access this, anyone can do it and be trained in it.
Yeah.
So that really opens up a lot of options for people to get treated when they're on waiting lists to get into programs and things like that. So it's fabulous from that perspective too.
Yes,
All right.
that's a great idea.
I could keep talking about this, but we're going to wrap it up for today. Thank you so much for being here, Libby. It was truly a pleasure. You are a wealth of knowledge, and I hope people check out what you're talking about because you've got a lot of great experience. So thank you.
Thank you.